Chronic obstructive pulmonary disease, or COPD, is a progressive disease that makes it hard to breathe. Currently, millions of people are diagnosed with COPD, but many more may have the disease and not know it.
Severe symptoms of COPD don't often manifest themselves until the decline in lung function has reached such a critical point that the patients are no longer able to comfortably breathe.
COPD comes with a collection of respiratory symptoms. Some call it a mix of emphysema, asthma, and chronic bronchitis. Early diagnosis and timely treatment are crucial in controlling the condition.
Many patients with COPD will develop shortness of breath, chest tightness, coughing more than usual, producing more phlegm than usual, more anxiety related to the inability to breathe.
COPD develops slowly. Symptoms often worsen over time and can limit your ability to do routine activities. It's been long considered a smoker's disease, but more and more non-smokers are being diagnosed.
It's now starting to become popular to believe that environmental pollution, smoke from factories, smoke from mines, burning wood fires, these things probably have a big role in developing COPD in non-smokers.
COPD has no cure yet, but treatments and lifestyle changes can help you feel better, stay more active, and slow the progress of the disease. For Lee Memorial Health System, I'm Amy Osher.